All right, time is 7 o'clock and very good evening, everyone. So let us be on time as usual. And ma'am is already with us, and I'm sure that other participants would join once the program starts. Anjali, ma'am, are you there?
Yes, sir. Yes, sir. Yes, sir.
Thank you, ma'am. Ma'am,
Thank
kindly
you.
please take over. Thank you so much.
Okay. Thank you, sir. So yesterday we have been see that what exactly the research design, what are the types of the research design, what are the methods of the research design, why we need the research design to implement any research proposal. Basically, the research problems are there, but whenever we come with a systematic methodology of the research, then whatever the outcome is there, it is accurate, perfect, and it is lead to the publication. A proper publication should be there. So everybody need to understand how the data collection is there. The basic things that we have been yesterday seen, that basic requirement of the research design, it is a number of variables, dependent, independent, confounding, mediating, moderating variables. What are the methods to collect the data? That is the primary data, secondary data, and all other methods of the data sources is there. Third one, sampling methods is also the one of the major part while we are selecting with the research designs, because any research design taken through the simple random sampling and any research design taken through the stratified random sampling may be giving us a different results. So that is why the sampling method is one of the part of it. So basically we have been seeing that the basic research designs are the descriptive or maybe experimental or the analytical. And in the descriptive research design, we have been seeing the case studies, case series, ethnographic research, cross-sectional studies, analog studies, and all other studies. And yesterday we have been discussed also some of the correlational studies also. But today we are going to discuss about the basics of the experimental study designs, examples of the experimental study designs, and what is a cross-sectional study, a case control study, and the cohort study. These three parts we are going to cover up today. Okay, so I will share my PPT over here. One sec. Okay, is it visible to all now?
Yes, ma'am.
Okay.
Yes, ma'am.
Yes, madam.
Yes. So this is a research design part 2. That is a research design framework for the scientific inquiry. This is a part 2 research design. So first of all, we are going to see that what exactly the research as yesterday. Basically, we know that it is a systematic research process. Second one, it is a very logical. Yesterday, we have been defined about the what is the inductive theory and what is the deductive theory. That is a theory to the outcome, or sometimes it is outcome to the theory. It's a logical things. Third one, it is empirical. That means totally evidence-based research is there. Then it is agreed. Otherwise, it will not. Next one, reductive theory is there. Reductive, that mean by that? It is a generalization of the data. A simple sample study will lead to the generalization of data. Any theory can be applicable to the majority of the people globally and novelty, then the theory is useful or the research is useful. Without any innovation, the research will not be useful over here. And the next thing is that it should be a replicable. That is, a research methodology is replicable, research is replicable. Wherever the experimentation has been done, it will give us the same results. It is a replicable. So this is the main base things of the research. So whenever we start the research process, the first step come with a review of literature. So review the available literature first of all, formulate our question, formulate objectives, formulate the hypothesis, then select the appropriate research design. Selecting the appropriate research design, that do you mean by that? All the things. That is the variables, data collection, sampling variables, sample design and all. Then we are going to collect the relevant data with it. interpret the findings with a properly data collection, data analysis. Many of the maybe the any computer software or by the manually, then we are going to publish the findings. And published findings will lead to the another research, that is a review of literature, or maybe lead to the other scope of the research. That is why in this way we complete our research process. So basically we are seeing that what is a research continuum. Now having given you the slide totally, then I will explain it. See here, a fundamental research or the pure research is totally sometimes accidental. It will not come with a process or a hypothesis. Sometimes it is a total accidental. The invention of the X-ray, it is accidental things. But the invention of a X-ray, it is a base thing, but it lead to many applied research. The base of the telephone inquiry, the research of the telephone, it is a basic theory. But application, it is a totally innovative. So wherever the research continuation is there, continuum means it is a continuation of the research. Then basically it is a very theoretical, more invasive. It may be laboratory based, or either it is a tightly controlled study is there, or may have the external validity is there. But sometimes it is a more reductionist. It is not more for the generalization. But whenever it come into the plan of the applied research, then we will get a quick answers of it. It is a less invasive, it is a field based, and it is a control whenever we are comparing this particular research with the other researches, and it is a totally controlled research and externally valid also, and a focus on the effect. That is why whenever we are seeing the research continuation, then we are thinking that what is the base theory is there, how the base theory has been coming with the research design, and how it can be converted into the applied research with the internal validity. That is why we are continuing the research like this. Moreover, based on the research toolkit from the methods of the lab, I distinguish these are the 4 levels. First of all, whenever the research is there, a level of expertise, something expertise I needed. Without expertise, it will not go. A total, whatever the investment is there or economy is there, that is also needed. Amount of time that is needed, number of staff that is needed. Based on the parameters, we can elaborate the research method or the research design which is applicable to our research. That has to be distinguished between these 4 parameters. Here I have taken the one of the example that basic research is that does the caffeine ingestion improve the Ca+2 binding in the troponin? Would this facilitate the ectomysium coupling? Would this aid B contraction? Does the caffeine ingestion improve the athletic performance? Applied research. I know that this is a base that this caffeine ingestion improves the Ca level or Ca level. This is a base research, but that is applicability. It may be applicable to the improve the athletic performance. Another example, the applied research is, does the caffeine injection inhibit the glucogen phosphorylase, or the caffeine injection increases the lipid metabolism? This is a base theory, but does the caffeine injection improve the athletic performance? So which parameters or which variables we need to study, or which parameters has to be taken into the consideration, that has to be decided by the researcher. So researcher he may be knowing the outcome variable, and that is the improvement of the athletic performance. This may be my outcome variable, but the base parameters or the independent parameters or the independent variable should be chosen by the researcher itself. So what is a basically experimental research? Yesterday we have been seeing that a theory of stimulus response theory. Now you can see the picture over here. It is not a little clear picture because I have taken from the reference of it from the other reference. I have taken this. The simple thing is that the dog is there. They taken this particular experiment so many times that the dog is there and he needs the food. Again, what they did over there, that they put the food over there and whistle, the whistle is there. The same time, when the whistle is there, they are giving the food to the dog. This can be done so many times, so many times. After that, what happens? Whenever the whistle rings, the dog has a salvation. जैसे ही उनको whistle का आवाज आता है, उसके मुंह में पानी आ जाता है. The increases the salvation in a dog. This is a stimulus response theory. What is the stimulus over here? It is a whistle. That whistle is going to give the salvation to the dog. So to train the dog, particularly for the training the dog, at a particular time, they are giving them the food. Then this training has been given in this way. Whenever you say to the dog sit, then he is not responding you at all. But whenever you are saying the sit and giving the food and whistle, all the three things simultaneously, then naturally the dog will have the salvations and is ready to eat. In this way, the stimulus response theory works, and this is an experimental basis there. So basically, whenever the experimental research is there, the design, it is a design for the individuals, for the physical sciences, or actually the tangible things. So the scientific classical experiments is first of all performed in the high school sciences. So whenever we enter the high school, we are at the 8 or 9 standard. At the laboratory, we are doing the experiments. And it is same experiments that whenever the research is done. Imagine taking the two samples of the same plant, exposing them to the sunlight, while the other is kept away from the sunlight. The plant exposed to the sunlight is a sample A and the other is a sample B. Simple thing is there. But the plant in the other than sunlight will die. Sample A grows and sample B dies. Simple thing is that the plant needs a photosynthesis or the plant needs sunlight. Simple experiment is there, but we have done such experiments at the school level, but at that time also we have a simple experimental designs. So this is a majority whenever we are doing the experimental research. Is it only restricted for the quantity data or it is restricted to the quality data? No, there is no any bifurcation like such. That is, the data is a quantitative and do the experimental research. Data is a qualitative, then do the any descriptive or exploratory research or any mixed method of the research. This is not the case that any type of data is there and we want to find the comparison between the data, or one or more groups are there. We want to study before after study. We want to study about the after study, or we want to see that the more than two groups are there and we are taking the history of the groups, and again what is the changes or the improvement or the deprovement or the demotion has been come up with the experiments that has been studied with the experimental research. So basically we have been studied yesterday. It is a pre-experimental, quasi and the true experimental. But here you can see a particular model. This model, it is totally depends upon the experimental designs. So you can see over here, the stimulus is there, it is a subjective norm is there and facilitating conditions are there. But our outcome is, the outcome will say that it is a behavioral intention. This subjective norms and facilitating condition has a variables as a technology anxiety, self-efficacy, or the perceived results, or the perceived usefulness. So this all lead to our hypothesis. This may happen that this subjective norm leads to the hypothesis 1, technology anxiety. It may be having the perceived usefulness, and these two together will lead to the behavioral intention. Simple thing is, whenever we have a new mobile, we have in our hand the new mobile, then our behavioral intention has been changed. It may be its brand, it may be its usefulness, it may be its self-efficacy, it may be its technology anxiety is there. But the 8 days, 10 days, we are in the way of that particular using the new mobile. So this is a particular stimulus, it's a particulars, and we are leading to the responses. And this response will lead to each and every different hypothesis. And this proving this all hypothesis will lead to our model of the experiment. And this model will lead to our experimental research design. Okay. Nowadays, it is very easy to draw such a diagrams with a PLS same method. It is a PLS Smart 4.0, but this diagram has been taken with a particular reference. This is not my diagram, it is taken from the other references. So this is the way we can express the experimental design. In the pre-experimental design, either a group or a various dependent groups are observed in the effect of application of independent variables. Simple, which is presumed to cause a change. That whenever a stimulus is given, then how much effect or how much a stimulus is changing the independent variable, that we need to observe. It is called as a simple pre-experimental research design. Yesterday, I told you that the pre-experimental will come with the laboratories, maybe animal houses, or maybe in a simulation method. So the pre-experimental research design will give you the one-shot case study. That means we are observing only one variable over here. Okay, only one dependent group or the one variable we are causing the change. But the one group pre-test and post-test study, that means a single group is studied before the treatment and after the treatment. The single group can be given a questionnaire before the training. The training is given. Then after the training, again the same questionnaire has been filled. Then what is the difference between the before and after? That is a one group pre-test and post-test research design. A static group of design, that means two or more groups placed under the observations. That means simple a placebo study. A placebo is given as a static group and the other observations is done on an independent variable. That is a pre-experimental research design. Next one, a quasi-experimental research design. The word quasi means partial or half or the pseudo. The quasi means partial, that means the data is taken yesterday I have taken for the not randomly assigned samples. Quasi experiments, that is the participants are not randomly assigned. In such a, they are used in a setting where the randomization is difficult or impossible. Sometimes, suppose you are taking somewhat investment studies, then people are not ready to give you the financial information about them. They are restricting to give the financial information. At that time, what will happen? You will choose a cohort, or you are choosing a group of people which is very close to you, or maybe those are your relatives. In that case, randomization is very difficult. Okay, in that case, it is very difficult to collect the data. In that case, we are using the quasi-experimental research design. Okay, it is very common in educational research where the administrators unwilling to allow the random selection of the students for the experimental samples. Okay, the some of the examples of the research design include the time series. Okay, or the time series data, or a behavioral patterns data, or the rare diseases are there like schizophrenia or other sex related diseases. The people are not giving the information at that time. At that time, we are going to use the quasi experiments. The quasi experimental design, for example, this method is used for the effect of integrated care on the quality of the work in nursing. A quasi experiment. That means the quality of the work in the nursing homes cannot be explained by the nurses because training is given to the same, but it can be taken with the feedback of the nurses. So the non-equivalent pre-test, post-test control group design was used in this study. The same. The data is collected by questionnaire. The results showed that the intervention appeared to be successful in the somatic wards. So the caregivers of these wards are more successful in creating the home-like environment in the residents. Regarding this effect of the intervention, the quality of work factors, the results included in the increase of social support by the supervision. So the intervention of these psychosomatic wards was unsuccessful through the introduction of integrated caretakers, where are the fairly successful. Now this is such a study is called as a quasi-experimental study, where the randomization is not possible. We need to take a purposeful sampling method over here. So one of the quasi-experiment, it is a time series design. The design is useful when the experimental wants to measure the effect of treatment over the long period of time. Already told you the time series means the such a designs are used for the predictions. Okay, used for predictions, and the follow-ups are there. It may happen that take a simple example of the medical experiment. Then it may happen that the treatment is given to the patient. Some of the patients may be cured at the fourth follow-up. Some of the patients will be cured at the fifth follow-up, or some of the patients are not cured at all till the end. Or it may happen that some of the patients are just dropping out the experiments. In this way, the time series design will say that it may be for the single subjects or may not be single subjects. So the timely follow-up of the data or timely follow-up of the events in the research design, that is a very useful. And this will lead to some of the what I say, the falsification and fabrication of the data. It is possible in this time series, but some of the type of quasi experiment, it is a time series design. So the true experimental design, a true experimental research design rely on the statistical analysis that to approve or disapprove the hypothesis. Experimental design, then it must have the hypothesis, and the statistical analysis will approve the or disapprove the hypothesis. It may be parametric, it may be non-parametric, it may be quality type of the data, it may be quantity type of the data. But still, in the true experimental studies, the major thing is that there is a control group, and control group is there, standard group is there. There are some precautions or the measure that how you can choose your control group, but still the control group is there, and which is called as a true experimental studies. Whenever the true experimental studies are there, we are using the consort guidelines to write a publication, to write a proper dissertation, or to write a research article whenever the true experimental studies are there. In the true experimental study design, there is a post-test only. That is a control group design. Subjects are randomly selected, assigned to the two groups. One is the experimental group or a trial group or a control group. And only experimental group is treated, not a control group. Why the control group is not treated? Because the standard results of control group is already published. So there is no need to do the experiments on the control group patients. Second one, pre-test, post-test control group design. In this control group design, subjects are randomly assigned to the two groups. Both are presented, but only experimental group is treated. Okay. The Solomon 4 group design, this is a combination of pre-test only, and pre-test, post-test control groups are there, but more than 4 groups are there, which is called as a true experimental research design. Now, what are the types of true experimental research design? These are all the types of research design. First, our post-test only. Do the experiment and take a pre-test, post-test. Before and after, the observations can be taken, data collection is taken, and statistical analysis will done. For four groups. That means more than 3 groups is available. Every group is treated as before, after, before, after, before, after. Next one, crossover design. Crossover design means what is happened. Suppose there are the 2 groups. One is the experimental group or the other is a control group. A drug A is given to the experimental group, drug B is given to the control group. After some time, the experimental group is treated by the drug B and control group is treated by the drug A. So there is a combination of comparison between the drug A, drug B, comparison between the drug A and drug E, drug A and drug A after some time, before, after. Again, comparison between the drug B before, drug B after. In this way, there are the 6 combinations, which is a crossover over there. This is called as a true experimental research design. And sometimes we are having a CRD or randomized block designs also. Whenever the CRD is there, we are considering only one outcome variable. But sometimes we are taking the more than 2 outcome variables with a randomized block designs, or the conditioning variables are there, then we are using the Latin square designs also. So these are one of the types of true experimental design. There is a large scope to have the experimental research design. So this is one of the example that a random assignment is given. Remember this, whenever the experiment is there, random assignment is always there. Experimental group, treatment is given, post-test. Control group, treatment is not given, but the post-test is available. Second, random assignment, experimental group, pre-test, treatment, post-test. Control group, pre-test is there, post-test is there. Okay. Again, random assignment, experimental group, control group. Pre-test, treatment, post-test. This is a which is we call it as a exposed to the disease. And this is the another group which is not exposed to the disease. Experimental not group 2, which is not exposed to the disease, but the control group 2 giving the treatment and post-test, and treatment is not given to the post-test. That means these are the patient is having the diabetes and we are treating them. And these are the patient which is not having the diabetes, but those may be a pre-diabetic patients. So again, we are taking the treatment and the post-test. It's a random assignment. Okay. So in the factorial design, sometimes researcher manipulate the 2 or more independent variables simultaneously. That means we need to see the effect of that particular confounding variables, and to see the effect of confounding variables, we are using the factorial study designs. For example, this is a factorial study designs that the frequency of the mouth care 4 hourly, 6 hourly and 8 hourly, beta 1, beta 2, beta 3. So protocols of the mouth care, one is given the cholesterol, alpha 1, saline, alpha 2. Then the combination will be alpha 1, beta 1, alpha 1, beta 2, alpha 1, beta 3. This is one of the combination. And this is the saline as another combination. Now, we need to find out that which combination is more effective. Such a design is called as a factorial study designs. So, what are the characteristics of the experimental research? Experimental research contains the dependent, independent, and extraneous variables. Extraneous variables means those are the variables, those may be directly affecting the dependent variable or indirectly affecting the dependent variables. Okay. And sometimes we are manipulating these variables. The setting is where the experiment is carried out. It is very important. Where we are doing this experiment, is the laboratory available, is the hospitals are available, is the universities available, or the laboratory to give the extraneous variable, all the infrastructure should be available for the experimental research. Multivariable experimental research may include the multiple independent variables. For example, time, skills, test scores, or the parameter basic standard protocols are there, that it is a multivariable. Why to use the experimental research design? It is majorly used for the physical sciences, social sciences, education and psychology. Experimental research is used to provide a proper treatment of the disease, that is a clinical trials. Everybody, the students from the medical background is over there, then it will show us a phases of the clinical trials as a phase 0 laboratory trial. Phase 1, it can be done with healthy patients of the 100 to 200 people. And phase 2, it is unhealthy patients or disease patients more than the 300. Phase 4, RCT, it is one group is the experimental group of the disease patient, another group is of the undiseased patient, and the RCT is conducting, and the drug, we are seeing the efficacy of the drug. And at the phase number 5, the drug is coming to the market after the proper licensing. That is why the experimental research is very important in the medicines. Education, aside from the science subject like a chemistry, physics, which involves the teaching student how to perform the experimental research. So the social scientists are also using the research on the human behavior, and it is also the experimental way. And suppose the product development phases are there, then major aim of the product team is to get a user experience with the products. So again, it is a experimental research designs. So what are the disadvantages? First of all, you know that it is not very economical. First thing is that very expensive research is there. Time consuming process is there. It is having the risky variables. we need to understand mediating and moderating variables. Sometimes this research is not descriptive at all. Okay. And the response bias will come. It's a major disadvantage of the experimental research, because the response is we are not getting any response, then our researches or the experiments is going to fail. So in this way, experimental research designs are considered as a standard research designs, because it will give that the ability to control of the extraneous variables. Sometimes it will give us the cause effect relationship between the variables, and it is very important to have the research design. So first of all, there is a random assignment of the equivalent. The key is that keys are, what is R? It is a random. Yesterday I told you what is a random. Random, reproductive, replicable, repetitive, randomly assigned. It is a random assignment. Sometimes we are taking the 20 individuals, all of them are assigned to the treatment group or the placebo group. Group 1, toss a coin for the each individual and think up a list of seems random. Okay. Simple experiment is there, random group experiment. But the observation 1 to a group X recording of the DV and observation group Y recording of the DV. We are just saying that toss a coin, but some people are thinking and tossing a coin, and some people are not thinking and just tossing a coin. Response is a more, that is a match pair design, or the match pair has been converted. So this is a simple explanation that what is a pre, quasi and true. A simple question is there, does a protein supplementation increase a muscle hypertrophy? This is a question. And if this is a simple question, then one short study. How we can do the one short study? This is that we have this ultra size. Variable we have chosen, it is only O1. Okay, only O1, one variable is there. Then it is a one shot study. Yesterday somebody asked me that what is a one shot study? It is answer that only one variable we are considering. It is a one shot study. इसके पीछे कुछ नहीं है. We are not taking the any history of the patient. We are not taking any previous records. We are not calculating the before things. Just calculating what will happen if the ultra size is given to this man. Simple study, one short study. Second group, one group pre-test and post-test. Now, this observation is already done with a pre-test. All the vital parameters is taken with the O1. We are giving them the ultra size and again checking the parameters. What is the efficacy of the ultra size? This is a pre-test and post-test observations. Now, the static group comparison. It is a placebo comparison. Ultra size is given and O1 is there, but the similar to the ultra size, one another bottle is come up and we are giving the finding out the result of this OA. देखो अल्ट्रा साइज का इफेक्ट आपको दिख रहा है ये पिक्चर में, और प्लासेबो का रिजल्ट नहीं दिख रहा है. Simple thing is there. So this is called as a static group comparison. Now the static group comparison will go with the diet again. Diet दिया, ये भी diet दिया, ये भी diet दिया. And with the diet, yes, we are looking at the what exactly the thing is there. Now this is a time series that O1, O2, O3, ultra size is given, O4, O5, O6. That how the in the process or in time the muscle will build with this particular ultra size. Quasi experimental design. Why the quasi experimental design is this? My question is that this is the time series design, but why this is a quasi? Is there a random allocation thing? No, this is not at all about the random allocation. But purposefully, we are selecting our samples, and for that purpose, we are applying the quasi-experimental design. Again, randomized group design, randomized control. The patients are randomly assigned. R is there. Randomized group comparison. And the ultra is given to the experimental group as well as the control group. Okay, randomly assigned. Pre-test, post-test, randomized compare group design. That means Before the treatment, experimental group is there. Before the treatment, data has been calculated. Ultra size is given. Again, the O2 after the treatment. Before the treatment, before the placebo given, the O3 observation is covered. O4 is given. So we are using the here before after PRT test for the one group, pre-test, post-test. Here for the second group, before after, again the post-test. But we need to compare in between O1, O3 also and O2, O4 also. Before test comparison should be there. After test comparison should be there. So how many pairs we are comparing? O1, O2, O3, O4. Pair t-test. O1, O3, O2, O4 is also there. Okay. So in this way, we can do the pre-test, post-test comparison with a t-test. Okay. Solomon 4-group comparison. You can see in the Solomon 4-group design, we are comparing 1 and 3 and O2, O4, O5, O6. So many groups has been covered and the treatment has been given. It is a Solomon 4-group comparison designs. Do you have any question with this or shall we proceed further? Yes. The same yesterday's part we are discussing. So I'm taken this in a hurry. So do you have any question?
Madam, can you please elaborate the term quasi experimental?
This one, quasi-experimental. The term quasi means partial, or the term quasi means half. It is not actually the experimental study design is there, but we are not taking a standard group comparison over here. Standard group comparison is not here. Whenever a comparison group is there, then we are call it as a true experimental study design. But the quasi means sometimes what happens, whenever we are taking the samples, we are not getting the data randomly allocated. It is difficult to get a data randomly allocated. It is not so easy to get a data collection from the people. So at that time we are using the quasi experimental study designs, and it is having the some of the follow-ups also. Take a simple example that we want to find the academic performance of the student. Then in the academic performance of the students, the same students can perform maybe in a T1 different, T2 different, T3 different, T4 different, at the end same exam different. But it will not be varied with his average results. Okay, the sum of the more or less the same results the student will give. That is why the quasi-experimental designs will lead to such as time series designs. That is the first follow-up. Again, after the some days, again follow-up. After the some days, again follow-up. And whenever we have such experimental designs, then it will have the quasi-experimental designs.
Okay, madam. Thank you.
Okay. So this is about the true experimental. Now we are talking about the case control and the cohort studies. Now we'll take first of all, case control studies. Our objective is a description of the disease or a spectrum, then it is a case series or the report or it is a cross-sectional study. I already told you that whenever we need a baseline data or whenever we want to find the incident rate, suppose in the Pune city, there is a traffic jam. Okay, then what exactly the average traffic time? What is exactly the average traffic jam time in the Pune city that I want to establish? So this is the baseline studies. The baseline studies can be taken with the multi-centers. Maybe it is taken in the, maybe at the metro levels, or maybe taken as a ST level, or it may be taken as a flight levels when the traffic jam is there. Okay, there may be something timing should be there as a cross-sectional study. So basically, whenever we want to set a one sample, or we want to set some incident, or we want to set some results. Okay, basic same results is there. Then it is a particularly cross-sectional study. We'll take a simple example of this, that whenever uh, the people from traditionalists, when they meet to each other, they will say namaskar. Okay, they'll say the namaskar. Okay, then think of the people like a Genesis. Okay, think of the people like Genesis, like 80s or 90s people. At that time, majority of the people are having the employments and all that, those things. White collar people are there. And those white collar people have started to have the shake hands. अगर हम मिल जाते हैं तो क्या करते हैं? Shake hand करते हैं. Simple thing is that. That whenever the 2000 has been covered, everybody, the students or the people or the youngsters are having the particularly Bluetooth in their ears. Nowadays, they say that they're just putting out the Bluetooth. It is also the greeting to the somebody. And we can understand this one. अरे वो हमारी बात सुन रहा है, यही काफी है. This is a greeting of that particular youngster to us. Okay. The spectrum has been changing from the traditionalist to the Genesis Y. How this change spectrum changes has been defined a different greeting welcome levels of the youngsters. And this spectrum will give you the cross-sectional study. It may be a different study, but the welcoming of the people, it has been changed. Totally, it is changed. And this welcome, you can write an article on this also, how the people are welcoming to each other from the traditionalist to the Gen Y or Gen Z. This may be happen in a different way. But it is some type of cross-sectional study that we are setting up some examples, we are setting up some baseline, we are setting up incidents of that particular events. Such as things are, we call it as a cross-sectional studies. Second one, determine the operating a new diagnostic test. It is also the cross-section, but describe the prognosis of it. It is a cohort study. Determine the cause and effect relationship. It is again the cohort study. Okay. Or suppose I want to compare a new interventions or take a new clinical trials, and it is a randomized clinical trials. So summarizing all these literatures, whatever the research design you have been used, it may be descriptive, it may be analytical, it may be experimental, but many of the studies has been done on the one topic, then we will summarize the literature with a meta-analysis. This is the meta-analysis things. So this is a pyramid of our research studies. That first of all, a vitro study, a bio study is there. Afterwards, the animal studies are there. Then the ideas, editorials, opinions are there. Cases are there. Case series is there. Case control studies is there. Then cohort studies is there. And the RCT is there with the double-blind studies. And at the last, we are having the systematic reviews and meta-analysis that works exactly which theory is applicable, exactly which protocol is applicable, exactly which SOP is applicable, that will understand with the systematic reviews and the meta-analysis. So this is a pyramid of our research study. So what is the design of this case control studies? So investigator want to select a cases with the disease and the appropriate controls without the disease. Controls don't have disease. Okay. Obtain the data regarding the past exposure to possible etiologic factors in the both the group. It may happen that previously it has a disease, but no, there is no, now there is no disease at all. And the investigator then compares the frequency of the exposure to the two of the groups. Now you can see over here what is the source population is there. This is a source population. Yellow things are the exposed to the disease, and the blue one is the unexposed to the disease. The blue dots are not here. Okay, blue dots are not here. And the cases, these are the some of the cases that we have been studied. So What we have done, from the source population, we have taken the sum of the sample. This is my sample. That the sample has been taken over here. Okay. But in the sample, it may be this sample is taken as a control. And these are my cases by the incident rate or cases by the prevalence rate. Okay. And some of the cases are also the unexposed cases are there. Now we are studying the cases and comparing the cases with the controls. Okay. So the controls are the sample of denominator representative with regard to the exposure. Okay. This is the exposure, but one of the cases which has been previously studied as a control. Okay. So whenever the case control study design is there, the population is at the risk level. Suppose take an example of the dengue cases. And population is at the risk level of the dengue cases. Then how many cases are there? How many dengue cases will occur in the particular geographical area? It is its incident rate. But how many are exposed to the dengue? डांस तो मच्छर तो सबको काटते हैं. Okay, simple thing is that everybody is having the mosquito bites. But how many people is exposed to the dengue and how many cases मच्छर ने काटा है फिर भी उनको डेंगू नहीं हुआ है? It is unexposed cases. And controls are the healthy patients who are exposed to the again the cases and who are unexposed to the cases. That is why cases before observation, after observation. These are the four types of this is before, after, before, after, before, after, before, after. That is why the case control study design is like this. Now the case control studies, we can in this diagram you can more understand this one. So these are the two groups. On these two groups, what we are doing, comparing the histories of the people. This is one group, this is another group. Comparing the history of this. The group of the interest, that is the cancer patients are there. Okay. And the another group of there is non-patients or the don't have the cancer patients are there. तो हमने क्या किया, जो कैंसर पेशेंट्स थे उनका हिस्ट्री ले लिया और ये जो नॉन कैंसर पेशेंट है उनका भी हिस्ट्री ले लिया. तो जब हिस्ट्री ले लिया मैंने तो सम ऑफ द फॉल्स, ये आप ब्लू देख रहे हो, ये जो ब्लू है वो कहीं ना कहीं हिस्ट्री में मुझे दिखाई दिया. एंड दैट ब्लू इज कन्वर्टेड इनटू द कैंसर पेशेंट्स. ये ब्लू भी दिख रहा है आपको. इट मे हैपन दैट इट मे कम फ्रॉम एनी ऑफ द जेनेटिकल इंटरवेंशंस. हो सकता है. यहाँ पे देखिए ये पूरा ग्रुप है, इसको कहीं भी हिस्ट्री लेकर भी हमें नहीं दिख रहा है और ये कंपैरिजन ग्रुप में नॉन पेशेंट्स के भी नहीं दिख रहा है. तो हिस्ट्री को मैं आई हैव टेकन द हिस्ट्रीज, compare the histories. Cancer patients are taken, exposed, unexposed group, the comparison is taken. With this all, we are drawing to the conclusions that is the cancer is a hereditary or not. This may be the one of the conclusion or any other conclusion is there. Okay. So such a study design is called as a case control disease. When we are using this case control approaches, rare diseases, care control approaches to most efficient rare diseases like a pulmonary fibrosis, cancers. Cohort approaches the large populations, but the case control designs is having the smaller sample size. So we can use the case control studies. When this particularly case control approach is used, a case is a certain system in a place. A conduct a case control study may be available in a certain system. Infrastructure availability, facilitated availability, feasibility of the study in the one geographical area, in the one laboratory, it is possible. Then it is possible to have the case control study. A population-based cancer registry, hospital-based supervision system. It is there, then we will go for the case control designs. When funding and time constraints are not compatible with the cohort studies, this is not economical. This is the studies economical, not so expensive. So it is possible to take some of the cases and compare it with the controls. So it is possible. So issue is the uncertainment of the cases. Some of the cases diagnostic criteria, that is a specificity or a diagnostic bias is there. validation is there, or the hospital or general population is there. These are the some of the issues and the risk to take a cases over here. So the issues in selecting the controls, then whenever the controls are selecting, it should be the healthy people, or the result should be already published. Then it should be a representative of the non-diseased people or the healthy people, and we should know the prevalence of the controls. So many issues are there to selection of the control is there, but still the control has to be done. So figure number 2, it is a reference population. Total population is here, but what we are going to study, it is our reference population. With this reference population, we are selecting our cases as well as the controls. Both are selected from the reference population itself. So issues in the selection of the controls, that is the control is feasible. That means funds is available or the controls are available. Sometimes it is not possible to find out the controls. So we are taking the directly the published results as a control. So the source of the controls, the population of the defined area, hospital patients, probability of the samples, or the neighbors, door-to-door, phone, letter carriers. These are some of the cases that we can find out the controls. So handling the potential confounding factors in the form of the matching, it is very difficult, because whenever we are taking the very generalized population size in any experimental design, it is very difficult to part of the matching, because certain diseases can be occurred in a certain age group. Then whenever we are selecting the samples or the controls, those are maybe the matching age group. Menopausal group, it is a matching age group should be there. Then we cannot take a age group of the any of the age group to for the study of the menopause. It is not possible. So the matching control should be there whenever we have the study, and we have the matching groups. 2 groups are there, or the 4 groups are there. More than 3 groups are there. It should be matches with the age, maybe matches with the sex, or maybe the races, or maybe the certain basic conditions. Basic conditions are there. Then those matching matching groups should be there, and those matching groups should be a homogeneous. Then and then only we can do for the cohort studies particularly. Handling the potential confounding factors in the matching. Matching the variable, it is a very near about difficult part, because the population in the experimental group, it is a very different, and population in the control group, it is again the very different. So the cases and controls should have matched, then we will come to some conclusion. Otherwise, we will not. So case control study, how it is done. Population at risk, ये already मैंने बताया. Exposed to the A, unexposed to the C, exposed to the B, and exposed to the D. So what is the odds ratio? AD upon BC. AD upon BC, it is the odds ratio, and with the odds ratio, we can find at what risk the disease will be spread. So the case control study, exposed cases A, exposed controls, unexposed cases C, and unexposed controls D. But the total cases are A plus C. Total controls are B plus D. And exposed cases are A plus B. A and case and control both. Unexposed are the C plus D. So the odds ratio is a AD upon BC. It is the odds of the exposure, that is a given disease is divides in the odds exposure. Suppose this odds ratio, it is a 1. Then case and control, there is no risk at all. But the odds ratio, it is a 0.59. That means less than 1. Then there is no risk at all of the disease. But odds ratio will come as a 1.35. Then we can say that there is a 35% more likely things are there that the disease will occur. This is the odds ratio. That is why to find the case control study, it is to find the risk ratio or find the relative risk in the data. That is why this risk ratio, it is a very important in the odds ratio. So what is the strength and weakness of this particularly case control study design? Rare diseases are there, then we are using the case control because sample is less, long latency between the exposure and the disease. explore the multiple hypotheses, and it is a clearly economical thing. But whenever the economical thing is there, but it sometimes it lead to the bias and insufficient exposures are there, and controls are unexposures. It is a less. That is why sometimes the study fails with the case control study. Now the next is there as a cohort study design. Do you have any question? मैं तो पढ़ाते जाती हूँ, मैंने आपको कोई क्वेश्चन नहीं पूछा बीच में. Is there any question from your side? It is a case control study.
Can you give any other example other than cigarette smoking, which is a very common example?
Or what case control study?
Yes, ma'am.
Cigarette smoking, it is a very common example. Okay.
Yeah.
Take example of the thyroid patients. Take example of the thyroid patients. Okay. How you can put a research design for the thyroid patients?
Having
Yes.
family history, not having a family history.
Yes, having the family history of the thyroid, it may be one of the group. And another, this may be a control group of you. This may be a control group of you. And actually selecting a people or actually taking the cases of the thyroid patient, okay, with a confounding variable of the age, or confounding variable of the gender, confounding variable of the profession, okay. This may be, it is your case study. It may happen that more the stress is there of the people, then it may generate the thyroid. Or a patient is having the previous history of the diabetes or a BP, then it may lead to the thyroid. ऐसे हो सकता है ना? So the case control study means we are taking the control as a previously diagnosed that a history में है, उनके मम्मी को है या फादर को है, कहीं तो है, but we can take a such a cases also that which is not having the previous history of the thyroid. In the case control study is there in this way. Okay, any other example that you can suggest me? Yes, ma'am.
Maybe menorrhagia and anemia. That can be one thing.
Yes, that can be a case control study. Menorrhagia and anemia. This may lead to the case control study.
Thank you.
Okay. Or a quality of the hospitals. That may be the case control study, ma'am.
Yes,
Because standards are already set. Okay. Standards are already set. But the keeping the standards does not lead to that every hospital is as per the standard. It is not possible. So it may be the one of the case control study.
So, ma'am, here the confounding variables, when they are there, they matter in the study?
Yes, they are matter in the study, but it is a researcher's work that either they can consider the confounding factors or either they should not consider the confounding factors. Because the thing is that all the demographic factors are the confounding factors. Okay. These demographic factors, sometimes we are not dealing with the demographic factors. For example, take a simple example of HbA1c value. Okay, it is a single factor that we are considering. We are not considering any other factors at that time. But these factors, maybe the other reasons are there or the causes are there that may affect that HbA1c value. उसके लिए हम खोज नहीं रहे, ढूंढ नहीं रहे. Okay, that sometimes potency of the drugs will also lead to some of the factors. Okay, that potency, it is maybe the confounding variable.
Yes.
Simple, taking the alcohol, it is a dangerous to the health. But taking the alcohol in a balanced units, it may be beneficial to the health.
Okay, ma'am.
Okay, in this way, the confounding may be, it is a researcher's work that either they have been added these confounding factors to the study or may not be adding the confounding factors, because so many factors are there. We cannot only rely on the dependent and independent variables. So to nahi hoga. That is why, first of all, whenever design is there, we set first of all the variables to set a design. First of all, the variables are set, then design is automatically set. Then we can decide that either we are having the one group or two groups or a comparison or case control or cohort. In this way, we can do the experimental studies.
Yes, ma'am.
Okay, non-randomized bhi hota hai na sometimes. Sometimes it is a non-randomized also.
Yeah, the sampling is non-random.
Yes, sampling, it is not randomized. Okay, cluster we are taking. As per the clusters, we'll go for the cohort only.
Yes.
So the cohort, it is a Roman term for the group of the soldiers that march together into a battle. It is a design that a cohort means having the similar demographic characters, having similar situations, having similar patterns of the behaviors. That is called as a cohort. Cohort is a group. Cohort is called as a group. But that group should be a similar, some matching parameters are there with it. That is why the cohort study design is there. So in the cohort study, the simple cause-effect relationship is there. That is, the exposure is there, and exposure is associated with the outcome. Already said, exposure is there, and is it associated to the outcome? Simple thing we will study about that. Take a simple example of using the sunscreen. Okay, a person is constantly sitting in the AC rooms, at the home also the AC, at the office also the AC, and traveling in the AC. Then is the sunscreen is effective or not? It may lead to another question, that a person is totally in the exposure of the sun, morning, evening, afternoon, every time he is exposure in the sun, and he is using the sunscreen, and is it effective or not? Okay, both the groups are there. Both the groups are there. That people is traveling in a totally sun and without sun, and is the exposure associated to the outcome, that is the sunscreen is effective. Okay, this may be to lead to the our cohort study. Okay, estimate the risk of the outcome to the exposed and unexposed cohort. Okay, same thing I have told you. A group of the people who is totally sitting in a AC and using the sunscreen, and what is the effect of it? And group of the people is totally in the sun, and what is the effect of the sunscreen? Total cohort study. To compare the risk of the outcome in the two cohort, that is a cohort membership is there. Why we are using this cohort membership is that a selection is a random, but the benefit is that anybody, a sample can enter into the cohort, and but entered into the cohort, or any of the sample can leave the cohort. मतलब ये 10 लोगों का मैं स्टडी कर रही हूँ और ये इसमें से 2 चले गए. Can the new membership is there, or the new samples can be added to the cohort? Yes, we can. But what will happen to the true experimental studies? It will not be happen. Because as per the consort guidelines, suppose my sample size is 25, then I need to give the statistical analysis of the 25 sample size. And suppose 2 patients are not giving the follow-up of you, or 2 patients are not giving follow-up, then I need to give the statistical analysis of the 23 patients only. At that time, entering into the cohort or entering into the group or leaving the group is not possible at all. But that is a benefit of the cohort study, that in the cohort study, anybody can enter or anybody can leave. Take a simple example that we are taking a survey of the cohort. Okay, suppose we are take an example of the financial literacy. Okay, financial literacy protocol is given by the government, but we are taking a cohort of 11th and 12th students. This is my cohort. Only 11th and 12th students in the Pune city. This is my cohort totally, and I'm going to find the, is there literally a financial literacy is there in the 12th and 11th students. Okay, what I'm going to do? It is a totally, our experimental group is there, or descriptive cohort study is there. Then we are giving the questionnaire. But Is all the students are available over there, or can anybody enter or anybody leave? Yes, it can happen. So this is a type of cohort study. Okay, so the free entry and free outcome or a free exit is available in a cohort study. So these are the two groups cohort studied. One is exposed group and another is an unexposed group. So exposed incidence is there and unexposed incidence is there. You can see this red part. Red blocks are there. This is exposed cohorts, exposed incidents and unexposed incidents. इसमें भी control है, इसमें भी trial है. Okay. So exposed group, unexposed group was there. Incidents among the exposed. सनस्क्रीन यूज कर रहे हैं लेकिन कितने लोगों को वो सनबर्न हो गया है. इंसिडेंस अमंग द एक्सपोज एंड इंसिडेंस अमंग द अनएक्सपोज. जिनको सनस्क्रीन नहीं दिया है फिर भी उनको सनबर्न हो गया है. इंसिडेंट अमंग द एक्सपोज. सिंपल एग्जांपल से आप समझ लो इसको कि एक्सपोज है फिर भी एक्सपोज में वी आर गेटिंग द इंसिडेंट्स एंड अनएक्सपोज इज देयर एंड स्टिल वी आर गेटिंग द इंसिडेंट्स अमंग द अनएक्सपोज्ड. So the group of interest is the smokers and non-smokers. This is the same example, but over the time follow-up is there. Over the time, then we can compare the outcomes of it. So it is one of the cohort study. So the cohort studies are of the two types. One is a prospective cohort and another one is a retrospective cohort. That is a historical study. Many times we need to find the retrospective studies and we need to find the prospective studies. Take an example of the sudden cardiac arrest. Okay. What will happen nowadays? It is a frequent cardiac arrest that we can see at the age of 35 to 40s. Okay. Why this happen? Okay. Is there any incidence of the COVID situations? Okay. This is a retrospective study. अभी जो cardiac arrest हमें दिख रहे हैं क्या उसके पीछे कोई कोविड के हिस्ट्री है? इट इज अ रेट्रोस्पेक्टिव स्टडी. पीछे कुछ है ये हम स्टडी करें. इट इज अ रेट्रोस्पेक्टिव स्टडी. एंड व्हाट इज अ प्रोस्पेक्टिव स्टडी? दैट व्हाट विल हैपन नेक्स्ट. अभी जो हो रहा है दैट इज दिस इज अ पर्टिकुलरली मेडिसिन्स और द ट्रेनिंग्स और द experiments that what we are doing and what happen in a perspective. Okay, green technology, coming up with the green technologies. Okay, is there any effectiveness of this green technology on the environment or any geographical values? That will be a prospective study. Okay, prospective study and retrospective. Wherever we go with the past study, it is a retrospective, and wherever we go with the future study, it is a prospective study. Here you can see the exposure of the people is there. Exposure is there and the disease occurs. Non-exposure is there and the still the no disease is there. No disease is there. Exposure हुआ है, disease हुआ है. Exposure हो गया, इसके लिए there is a disease. No exposure, no disease. Prospective analysis. Prospective analysis. Researcher need to find that is the disease occurs. That means is he having the exposure to the things. और अगर वो अभी एक्सपोजर को जा रहा है तो आगे जाकर he will definitely have the disease. He will definitely have that particular disease. ये हम प्रेडिक्ट कर सकते हैं और ये प्रेडिक्शन किस बेस पर आएगा? प्रोस्पेक्टिव कोहॉर्ट स्टडी के बेस पर ये आ जाएगा. Now the second thing is that the prospective cohort study, it is exposure is there within the, this is a timeline. अभी ये exposure यहाँ पे है. Study starts in between middle and the disease occurrence is here. Okay, so the study says that in the timeline the exposure is there, then definitely the disease will occur. This is a prospective cohort study. Okay, prospective cohort study is the time is the present. Okay, present and future. Exposed to the passive smoking, oral cancer or no oral cancer. Not exposed to the passive smoking, oral cancer or no oral cancer. This is exposure and non-exposure is there. But we need to find out what will happen. Okay, but passive smoking hai to naturally it will lead to some of the things. It may happen or may not happen. May happen or may not happen. But we need to find out the causes of it. So the disease status is uncertain with the subsequent initiation of the studies. Similar RCTs or the type of the cohort studies is there. Okay. Follow-up study. The study in which the subjects are selected on the basis of the exposure to the risk or received an intervention or possesses the characteristics are not followed to assess the outcome of the variable. For example, cases of the HIV/AIDS who received the HART and antioxidants therapy who received the HART. Okay, workers in the abstruse factories or office workers in the same factor. Are they having the exposure? And it may happen that in future they may have the cases of HIV. Okay, the assembling cohort exposed to the population and comparison group I need to study over in a cohort. Patients who had implants or without implants may be followed up for the period of the 1 year, or the newborn with a IUGR and no IUGR will be followed up with the end of the 25 years. Okay, this may be the examples of the cohort. It is not for the 1 year or 2 years. It may be having the longitudinal study with the cohorts. So the cohort is a closed cohort. It is defined as the time of exposure. RCT is always used when the cohorts are there. New members are not allowed into this cohort, but the existing members followed until they are no longer at the risk. Okay, this is a closed cohort. But the open cohort is there where the new members are allowed in, old members allowed to out, and define the geography, age, incident rate, but not a cumulative incidence can be calculated in the open cohort. So closed versus the open cohort, the fixed membership at the start of the follow-up period. Okay, no one is added after the follow-up begins. Then, for example, Framingham's heart study, nurses health study, physician's health study, or the RCTs. This is one of the closed cohorts. And open cohort, it is a dynamic cohort or the dynamic population. Whenever anybody can enroll the new subjects at the start of the follow-up period. Okay, so we need to observe the study in a geographical populations. This is a difference between open and closed cohort. So, progression of the hepatitis B infection. Short-term infection is there, resolution is there, long-term carrier is there. Resolution, long-term hepatitis. Resolution is there, again, cirrhosis is there, silent cirrhosis, liver cancer, and the death, 30 to 50 years. Short-term infection से अभी हुआ है, लेकिन at the age of 30, then death will be at the liver cancer with the age of 50. Progression है, ये progression hepatitis B का progression है. In this case, these 30 to 50 years is a cohort study. Totally a cohort study of the 20 years. Then this will lead to the study. Retrospective cohort study. Exposure, disease, non-exposure, no disease. Simple. But the researcher has the retrospective analysis. Disease is occurred, that means it has exposure. Or disease is no occurred, no disease is there, then no exposure will be there. So we need to find what is the past history of the patient, or is there any exposure of the risk is over there to have the disease. So retrospective cohort studies, in the time frame, the exposure is there, disease occurrence is there, but the study will start after the disease. That is why it is a retrospective. So retrospective design, it can be quickly and cheaply. Efficient design for the disease for the long latency periods. But the depends upon the quality of the existing records. It needs a records, hospital charts, military records, union records. These records are available, then only retrospective study design is available. So the cohort study, identify the group of exposed subject, unexposed subject, follow-up of the disease occurrence, may be prospective, may be retrospective, but the matching criteria of the RCT should be there in the cohort study. So our objective is to compare the incident rate in the exposed population, and the rate would have been observed in the same population, same period, which is not exposed. The same population, same times, those are all the matching variables. So the prospective study designs control over the quality of the information. Okay, exposure disease or the confounder may be there. It is having the proper follow-up period. Follow-up long period is there, then we can come into the result of the cohort studies. The cohort study, it is a gold standard of analytical epidemiology. Case control studies have been their place with the epidemiology, but cohort study possible do settle for the second best. True experimental is the best, RCT is the best, and second one is a gold standard. So this is from me. This is about the today's lecture. So do you have any question?
Yes, ma'am, I have. Actually, I'm a bit confused in between cohort study and longitudinal study because both are for a period of time.
Both
So,
are for the period of time,
yes,
but
ma'am.
longitudinal, it is a part of the cohort.
Longitudinal is the part of cohort. Okay.
Cohort study. Longitudinal study is there, then it may be a cohort study. But cohort, we are seeing that having the group of similar respondents. But in the 20 years, is the respondents are the same?
Yes, okay, ma'am. There will be changes in the respondents.
There is a changes or the variations in the
Respondent.
data. It is a
Yes.
longitudinal. Okay.
Yeah.
That is why we are differentiate between the longitudinal and the cohort.
Okay. And cohort, it will be
I will give,
follow-ups.
no. I will give you one example that you
Yes,
will
ma'am.
understand this one, that a cohort study is taken for the goal setting. Okay. In the Harvard University, they have taken a batch. Okay. The batch of 1960. 1961 batch is there. At that time, they told all the students for the goal setting procedure, and they define all the parameters of the goal setting. Okay, but the same people, when they are very young at 1960, after the 30 years, after the 30 years, the same people has been examined as a research. Okay, and what they happen, the people, 10% students have been set a goal, proper goals in their life at their young age at 1960. But who has defined their goals in the time frame, those people are, those 10% students are very successful in the life. But as a vice versa, the goal setting parameters has not done by many of the students. And after the study, after the 30 years, they found that they are not as successful as the other people that who has been prepared for the goal setting. Now, are these studies a cohort or are these studies a longitudinal?
Cohort, ma'am. The participants are changing.
Participants are same.
Same.
Participants are same participants are there, but after the long period they has been studied for this cohort.
Yes, ma'am.
That is why it is called as a cohort, because all are the matching criteria are there, people are the same, their behavior is the same. It may be differ with the economy or any other confounding variables may be there, but the people are the same. Okay, that is why it is called as a cohort study.
Yes,
In the
ma'am.
longitudinal, what will happen that how much success rate of that particular goal setting, this can be also done. Okay,
True, ma'am.
what is the effectiveness of the goal setting criteria? Okay, this can be also studied, this can be also studied in Harvard University, but this study will come under the longitudinal because respondents are changing over there. Every year the new batches will come. Every year the new students will enter. The other students will exit. This may happen. Okay,
Yes, ma'am.
this may happen. But the standard of that particular university may be hampered or may not hamper. Are you getting me?
Yes, ma'am.
Yes. Suppose we set a criteria of the NAC A++. Okay. Then how many institutes are there having the NAC A++? Okay. Then why we are taking the every year the progress report of NAC++, A++? Why there is need to take every year of the criteria of that particular? अगर वो A++ अभी डिफाइन हो गई है तो आगे जाकर हर साल हम क्यों ले रहे हैं उसका फीडबैक रिपोर्ट क्यों कलेक्ट कर रहे हैं? Because there is a variability, there is a change, there is a changing longitudinal study. मतलब ऐसा नहीं है ना कि अभी एक इंस्टीट्यूट को NAC A++ मिल गया. It does not mean that after the 5 years also it will set as a accreditation as a NAC A++. No, after the 5 years it may change. It may change, it may be progress, it may be regress. But the
Correct,
overall
ma'am.
data should be as a, it will not take as a cohort. It will take as a longitudinal study. We can have the milestones of that particular thing. The milestones will say. Take another example of the marketing. I will tell you. हमारे यहाँ पहले लोग मिश्री लगाते थे. Okay, mishri. Simple thing is then mishri. Everybody know what is mishri. The mishri is there. Then sometimes people are using that kadunimba kadi. Sometimes people are using salt. है ना? Salt. Yes, Sarah. These are our Ayurvedic patterns of to have the cleanliness of the tooth. Huh? Afterwards, what happened? The Colgate will come into the market. Colgate market में आ गया. So what they said, using that rakhundi and mishri and salt and kadunimba kadi, it is unhygienic. Okay, so they come into the market with a paste, Colgate paste. So every doctor is prescribing the paste. Now after the 25 years or 30 years, everybody is using the paste now. Maybe different types of paste, but everybody is using the paste. Now afterwards, what happened? Again, the research come into the market that what is appropriate to use for the tooth? It is again salt. Again it is a kadunimba. Again, the Ayurvedic pattern has come into the market, in the global market. So what the Colgate has did?
Added all those things to the
Added
Colgate.
all those things to the, again the paste. The Colgate with a salt, Colgate with a charcoal, Colgate with a mishri and all those. Add तो कर दिया ना उन्होंने. So
Yes,
this
ma'am.
we call it as a longitudinal study. Okay, but this longitudinal is a comparative. Yes, it is a comparative. Comparative with a standard. अभी ये efficacy है या नहीं वो अदर बात है. वो छोड़ दो उसको छोड़ दो. But the brand value they maintained. With a single parameter of the brand value, they maintained for the 30 years. Yes or no?
Yes, ma'am.
So that is why whenever we are setting a research design, these all the variables are very important. That which are the variables? What is the outcome variable? What is the independent variables? What are the confounding factors? How these variables can be collected, measured, scaled, and put into the data collection. Then the sampling method will come. Sampling method will say you that what exactly the population and how we can extract the sample from the population, either by the cluster method or stratified method or the snowball method or purposive method or judgment method or a simple random sampling method. So again, this sampling will lead to our research design. Then the sample will be taken. Then the any type of descriptive research or experimental research or the cohort or case control, this research has been done. But whenever the research has been done, then only the analysis will say you that is your hypothesis is approved or hypothesis is not approved. And sometimes in a descriptive researches, hypothesis is not done at all because it is a deductive thinking. Then we come to somewhat conclusion may be comparable not maybe comparable. Okay, then we'll come to some conclusion and we will come to the finding of the research, and they will go for the publication purpose. So this is all the journey of this particularly research design. So setting a blueprint of our research, setting a proper, what I say, a map of the research, that is very essential. It may happen that in the journey of the research, the objectives may be changed, the hypothesis may be changed, but the other things will not be changed. The variables will not be changed. Data collection, data collection method will not be changed. Results will not be changed. So it may happen that it may be changing with the data analysis, but the conclusion is there. So that is the importance of the proper research design. That is very important. So this is from my side. If anybody has any questions, then do ask me, please.
Ma'am, I have one more question.
Yes,
This case control study is similar to observational study,
yes, that is similar to the observational study.
because in that researcher is not intervening in the method.
Yes,
So
researcher is not intervening. Researcher is not any interrupting the research.
the intervention is not there from the researcher
Intervention is
side. So
not.
it is similar to observational study.
Yes.
Oh. Ma'am, are there any risk in case control of biasness from
Yes,
the
bias is
researcher?
always there in case control. That
Uh,
is why
uh,
we are referring to the true experimental or the cohorts.
yes, ma'am. And how do we validate
More,
if in
more,
case?
no,
Yeah.
we can minimize the bias only.
Okay. Like if we are going through any observational study or case control
We already
study.
discussed about this, that there is a selection bias,
Yes,
observational
ma'am.
bias, or
Mm-hmm.
measurement bias,
Mm-hmm.
instrumental bias. Okay. Halloween bias is also there. So such a bias types are there, but we can minimize it. We can
Okay.
minimize the bias.
As a reader, when we
As
read
an error,
articles for literature review.
in a
Mhm.
statistics, we are always accepting the error. We are
Okay.
not eliminating the errors. Okay,
We
whatever
are
the
just
error is there,
minimizing it.
we are minimizing it. If the minimum error is there, then we are going to accept it at the 5% level of significance. So we are
Mhm.
accepting the error before to start the study. Before to start the study. That's why.
Ma'am, when we write paper, when we do literature review, so at
Hmm.
that time when we see some observations, so how do we validate that we should add it or we should exclude it? Like from very layman prospectus. So how do we do that? How do we know that this is out of biasness, that the data is correct?
No, the data is correct will lead to whenever we do the data analysis. That is
Okay.
why, first of all, whenever we are framing the questionnaire, okay, there is a procedure to validate the questionnaire. Okay, and that procedure is called as a skill development procedure.
Okay.
Whenever we have that skill development procedure with us, then the skill development will lead to that the particular so many multicollinearity factors are there, normality factors are there. Again, the what you call as AVG values are there. It is a statistical patterns, but if you are interested, then I will take a different workshop on the skill development patterns, because it is a very critical thing that how to develop a new skills in the market or how to validate the questionnaire. Okay, it is a
Yes,
different
ma'am.
thing. So it is a one more workshop on the skill development methods.
Yes, ma'am.
Yes.
Thank you, ma'am.
Okay, thank you.
Thank